Hello, everyone. This is Dr. Joseph Bryant Jr., the Executive Director of our West Coast region, our Silicon Valley office, and just so proud and pleased to be able to introduce to the nation, to the world, one of our key faith leaders here on the West Coast, here in Northern California, who's done such a phenomenal job. We want to celebrate him for the impact he's had over this past year and a half professionally. Just so proud of him as a medical professional researcher for the Department of Family and Community Medicine for the University of California, San Francisco. Not only does he have his PhD, but he has his MDiv. So he's also a clergyman, minister leader at the historic Third Baptist Church, where one of Reverend Jackson's dear friends, Dr. Amos Brown, is a senior pastor, and Dr. Butler serves on staff there. But more than anything, Dr. Butler has led the charge of educating us through the pandemic, equipping us through the pandemic, and empowering us through the pandemic. I couldn't think of anyone who was more qualified and worthy to be celebrated for all the hats he wears. So thank you, Dr. Butler. This is just a privilege to have this moment. Ladies and gentlemen, my brother, Dr. Jonathan Butler.
Dr. Brian, I'm most appreciative for not only just your friendship, but you're helping me to elevate the coalition. You know, the coalition is comprised of 21 churches in San Francisco, and our main mission is to eliminate health disparities. And it falls right in line with my professional interest. And so I'm a social epidemiologist, and part of that work is to help to educate the public. And so during the pandemic, I had to rise up to the occasion. As you know, there's a lot of disparities in COVID-19 among African Americans. And it was important for me to educate the people about the pandemic. And also, as we have known, we have 3 vaccines that are made available to our community. And there were a lot of questions. No doubt. There's a lot of mistrust in the government, a lot of mistrust in the healthcare system. So it was important for me to step out, be on the front lines, educate the people about the vaccines. Not only educate, but provide them with opportunities to take the vaccine. So earlier this year, we decided that we weren't going to hold back, and we were going, as churches, we were going to lead in terms of providing vaccinations to our communities. And to date, we have provided at least 800 vaccinations to our communities. And it is because of the work of the churches, because of the work of the coalition, pastors like yourselves, open up your churches so that we can provide vaccination clinics. And we didn't just provide vaccination clinics. Obviously, you know that we do food security work. And so we also meet other needs of our community outside of vaccination through food security, providing referral services to our community members in terms of their needs. And now we're focusing in on education. And all of this is part of what it means to be a social epidemiologist. My goal is to ensure people have a quality life. And we know that education is at the core of that. And so I have been focused during this pandemic to ensure that we not only educate our young people, but we also pay attention to our seniors, providing them with the resources. And so this is all coming together for me. The church and health, that's exactly what I have always wanted to do in my entire life. And this has given me an opportunity to not only do it, but thrive at it. And I have the privilege of working with the coalition to help me to reach our shared mission, which is to eliminate these health disparities among our people.
Right. And that's such a wonderful goal. I mean, coming into the year 2020, I'm sure you never expected that this was what your work was going to look like. Never. However, you are well prepared as an HBCU graduate.
That's right.
As a divinity student, as a medical researcher, as you know, you prepared yourself for this. And so here you are, beginning of 2020, and you're working at UCSF, you're doing some health projects, but then all of a sudden our world is set on its ear because of the pandemic. And really, Dr. Butler, one of the reasons why I thought it was important for us to honor you, recognize you, and celebrate you is because we needed you, not only because of your leadership of the coalition, but because of your expertise. You were prepared to help us learn, because even before we knew where things were going, you were talking about us getting tested. And so you helped us with the testing side. And then when it was time, we did as they did in the Bible. They prayed for Peter to get delivered and didn't realize that he was at the door and thought it wasn't him. And so you have had a unique perspective. Talk a little bit about the journey for you. Even give a little shout out to your HBCU. I'm not going to call it out, but just in terms of your preparation for the moment and how you were ready to help us to deal with what we've dealt with the past year and a half.
Dr. Brian, I'm glad you brought that up. I'm a proud Howard alum, and I actually went to Howard Divinity School and also Howard. I got my PhD at Howard University. And to be honest, that experience actually has prepared me for times like this. I think one of the joys of being in an HBCU is they do prepare you for crisis moments, that they make sure that you're ready. Like there was a lot of work involved in the preparation of getting those degrees, but it is also the experiences that I had prior to the pandemic, even at Third Baptist Church, and how there was a crisis in the Black community prior to the pandemic, and there was, in essence, the responsibility of folks like me to kind of step up to the plate and continue to prepare myself for times like this for a pandemic. So I think just my education experience at Howard, being at HBCU, has prepared me, but also the experiences prior to the pandemic has also prepared me for this time. Now, I won't say that I felt prepared, but I felt the call to actually do my best. And I think that was what was required of me, is to just, take the risk, step out on faith, and actually do the work. And sometimes you fail, but you just try again. And that's exactly what has happened. And we've just been privileged to be able to, or have been privileged to be able to work with the pastors, work with other funders that have helped us, city officials, those in my colleagues at UCSF. So this is really a community thing. And, I've just been able to carry sort of the load for all of us together to get to this point that we're in now. We're in a great point in our pandemic and the African-American community at this moment. There's a lot of work that we should be, that we need to continue to do, but certainly wouldn't be able to do all of the work that I've done without the help of those that have, provided their support, like yourself and the other pastors and funders and the like.
We only have a few seconds left, Dr. Butler, but I would be remiss to have you on as a health professional and not give you a chance to give a 30-second promo to those who are still apprehensive about the vaccine. Those who are still hesitant, especially in our community, still have questions. What do they need to hear from you, not only as a minister of the gospel, not only as a child of God, not only as a concerned community leader, but as a trained and qualified health professional? What do we need to hear from you? Give us your 30 to 60-second pitch to that person who still doesn't know whether or not we should trust this thing, and what we need to tell them. What is the message for that person to know about the vaccine and the vaccination process?
Thank you for giving me the opportunity to share that. I think it's certainly important. Right now, we're in a phase where there's a lot of hesitancy, obviously, amongst our people. And what I say to you is, take the vaccination when you're ready. I think at the end of the day, what we want to do is stop the spread of COVID. So obviously, you're going to have to continue to wear your mask. You're going to have to continue to social distance and take all the other protective factors that you can to prevent yourself from getting COVID. So, at the time, you may not be ready, and that's okay. I think there will be a time where you will have to step out on faith, take that risk. But in the meantime, I think that is important for just you to protect yourself. And as you're protecting yourself, you're protecting others. There are a lot of things that I understand that people have in terms of the hesitation, the mistrust in our government, the mistrust in our healthcare system. And that is to be noted, and I understand that. But at the end of the day, what we want to do is ensure that we stop the spread of COVID-19. So even if you're not ready yet, there are some things that you could do to protect yourself and your community.
Ladies and gentlemen, my friend, my brother, who I'm grateful for leading the charge here in Northern California and really doing a tremendous job in all of the hats that he wears. Let's celebrate Dr. Jonathan Butler. Thank you, Doc.
Thank you. Thank you, sir.